So I remember the 68-year-old male who came into the office, and he really had no medical problems. We were treating him for hyperlipidemia, and his cholesterol was under excellent control. But in looking at his history, I said, you know, we have an EKG and we know that's normal, but an EKG doesn't always give us the exact amount of information we need to know about your heart. So if we're talking about prevention, we'd like to do other tests. There are stress tests we can do, but actually insurance doesn't pay for us to do a stress test because you really don't have any symptoms. He had no chest pain, no shortness of breath. He exercised on a regular basis. But I said, you know, since you're concerned about your heart, I think maybe a reasonable thing to do is something called a pure scan. We actually do a CT scan and we look for calcification within the coronary arteries. And again, here's a 60-year-old guy who had absolutely no symptoms, but on his pure scan he had a very high score. And what that means is there's a lot of plaque in his coronary arteries. We subsequently, because of that, and again, even though he had no symptoms, we did a stress test that showed he had major blockage of his coronary arteries, and he subsequently had 3 stents put in. Okay, and now he's doing wonderful, and again, he had absolutely no symptoms, okay, but because we were really focusing on prevention, we were able to find a problem at a stage before he had any symptoms and to correct that problem.